Welcome to the introduction of the post-birth alert system. I am Danielle Wittig, a registered nurse at FHN Hospital in Freeport, and I serve as the perinatal quality nurse. I will be walking you through the implementation of the post-birth alert system that was initiated at FHN in July of 2024. Throughout this presentation of the post-birth alert system, we will reach these main objectives: to educate EMS, ED, and maternal health care providers on implementation of the postpartum alert system, and to inform EMS, ED, and maternal health care providers of their role in acknowledging a postpartum patient and gearing assessment findings toward the highest risk diagnoses for mortality and morbidity in this population. At FHN, the post-birth alert team is comprised of a multidisciplinary team including leadership, staff nurses, and the emergency preparedness coordinator who helps connect us to the community EMS providers. We have made it our mission to bring awareness to complications the postpartum patient is at highest risk for within 6 weeks of delivery to decrease morbidity and mortality in the community we serve. Our vision in the post-birth alert team is to collaborate with community healthcare providers, EMS, emergency department staff, maternal health nurses, and patients to increase awareness due to complications of the postpartum period. As healthcare providers of any kind, we always like to know statistics so we can make sure that we are making the biggest difference. More than 2/3 of postpartum deaths were deemed to be moderately or substantially preventable per the CDC report in 2022. Also in 2022, the CDC reported that 817 deaths in the postpartum period occurred. While it does not seem like 817 birthing persons dying throughout the country is a staggering number, it is still a child without a parent and a partner without their loved one. This can affect you personally. If we can prevent even one death, we can touch a lot of lives who would be affected by that one loss. As an emergency provider, whether it be EMS or emergency department, you may be wondering how you are going to recognize a postpartum patient. Before discharge from the hospital, each patient will receive this post-birth alert bracelet. This will be a bright orange bracelet with writing that states post-birth alert. With the support person or persons present, the nursing staff at the hospital will educate the patient on the importance of wearing the bracelet to alert EMS personnel and ED staff that they have delivered in the last 6 weeks. This can help to direct the care and assessments you give to this patient of postpartum complications. Patients are extensively educating using the post-birth alert sheet that AWHONN puts out, which talks about each of the 5 complications that are at highest risk for morbidity and mortality. They receive this education on discharge and then receive their orange band. Once the patient has had the 6-week follow-up visit with the OB provider, the birthing person will then be educated to stop wearing the bracelet. It is essential the support system also knows the reasoning behind wearing the bracelet because there may be situations that you are called to in which the patient is unable to speak for herself. Now that you have determined the patient is a postpartum patient, you can start to direct your assessment to whether the patient is experiencing a postpartum related complication. These are the 5 highest risk diagnoses for morbidity and mortality in the postpartum patient. If you see the band, you can start to gear your assessment toward these top 5 diagnoses. Target assessments related to these postpartum complications would include looking for preeclampsia and eclampsia, sepsis, perinatal depression, substance use disorder, cardiomyopathy, or venous thromboembolism. With the implementation of post-birth alert systems, the team is really hoping for the ability to collaborate with the ED staff when you are calling report. When the patient is known to be postpartum and having symptoms of the top 5 problems, the ED staff can then get into contact with the OB staff at the hospital and collaborate the care of this patient effectively. Communication and collaboration is key in saving lives, and if we can get this all done quicker, we are sure to have better outcomes for these patients. Assessing the patient while keeping in mind these high-risk diagnoses will assist in working through pathways for treatment of these patients, depending on the level of care that each department can provide, such as starting an IV for a patient who is exhibiting high blood pressure, so that can be treated as soon as possible when presenting to the emergency department. However, communicating the assessments to the hospital you will be taking the patient to will help to direct the care provided once the patient is in the emergency room. It is essential to have a collaborative team when caring for the postpartum patient. The main goal is to keep the patient safe and have OB staff come to the emergency room to assist in assessments prior to transporting the patient through the hospital to the labor and delivery department. We must keep the patient's safety and well-being at the front of our minds. For further questions regarding the post-birth alert system and implementation, feel free to reach out to me. Here is my email address, dwittig@fhn.org, and here is my phone number for questions, 815-599-6489. This is the After Hours Labor and Delivery Department if you're a local EMS and you have questions regarding a patient assessment. I want to give a special thank you to the creators of the Post-Birth Alert Orange Band, Jenny Wolf and Cindy Mitchell, who work at Advent Health Zephyrhills in Florida. Through networking and collaboration, the Post-Birth Alert program is possible. I also want to give a special thank you to the educational program that was created at FHN Hospital in Freeport, Illinois. Lynn Carter for being our leadership liaison, and our education partners, Michelle Allen, Alyssa Brunning, Robin Ortman, and Carrie Schubert.